Hi everybody, Dr. Britt Talley Daniel MD. I'm a neurologist, headache doctor, and I've written a large book on migraine entitled Migraines on Amazon. It's about 400 pages. It's really a textbook or reference book. And then I have a smaller book, about 40 pages there, also called Migraine. I have a web page called drmigraine.com, and I've written a blog post on the subject I'll be talking about today. You can read it in more detail there if you wish. So today I'm talking about, does Ajovy help migraine? And that's the title of the talk. Ajovy is one of the new calcitonin gene-related peptides. These are called CGRP drugs, which is used for treating migraine. Now the deal is that the migraine process liberates three chemicals: neurokinin, substance P, and CGRP. It's one of the chemicals, so this drug blocks one of the chemicals. I'm going to show you a picture of what I call the migraine timing cycle. And so you can see there at 1, the trigeminal nerve is located, and it's activated by the brainstem, turns on the ganglion, then it releases these three substances, one of which is CGRP. And these have a chemical reaction over on 3 on the meningeal arteries, and the stage 4 to work on the thalamus to inflame it. So migraine is a chemical inflammatory condition. I also have a blog post on that subject if you want to see it, to learn about it in more detail. Alright, so the question is, does Ajovy work for migraine? Yes, the FDA released Ajovy for use in the United States in August of 2018. It's had a grand success for migraine patients. But more interestingly, this is one of the few drugs that's available for prevention of migraine. It works within the migraine cycle, so it blocks the chemicals that come out, whereas the previous drugs we had for migraine prevention didn't do that. So there are now 3 drugs like this. All right, how is Ajovy administered? Well, it's given as a 225 milligram subcutaneous pre-filled injection into the anterior leg, top of the thigh, or else 2 inches from the belly button. And a lot of people don't want shots and are needle phobic, kind of like. I tell my patients to, because the drugs work so well, to try to overcome the fear of that and consider that insulin requiring diabetics takes subcutaneous injections of insulin 4 times a day for life. This comes in a pre-filled syringe, and it should be disposed in a safe sharps container and thrown away. And the drug should be kept in the refrigerator cold until 30 minutes before you use it, and take it out and let it kind of warm up a little bit. It doesn't hurt so much if you let it warm up. Another question, does Ajovy interact with other drugs doctors may give, like a drug for high blood pressure or for peptic ulcer disease? Well, no, it doesn't. That's what's so unusual about the drug. This class of drugs doesn't react with any other drug. I've never seen anything like that in my career. 40, 50 years being in neurology and headache, never seen that. So it has no interactions with other drugs, whereas a drug like Penicillin, which was made when Fleming found that a mold that floated in his window in London killed all the bacteria on his agar plate. Penicillin has about 10 drugs you can't take along with it or make you sick. But these drugs have no interaction with other drugs, which is amazing. And it's made by this DNA polymerization process and then injected in the body. What are the side effects in taking Ajovy? Well, there can be a very rare serious side effect of hypersensitivity with allergic symptoms, but that's extremely rare. The most common side effects one can have are an injection site reaction, muscle cramps, or little spasms. The injection site reaction is like a bruise, like you get when you have your blood drawn from your doctor and they draw it out of your arm. It's a little bruise, lasts a couple of days and goes away. It's no big deal. All right, what are the benefits from taking Ajovy? Well, the drug lasts a half-life of 31 days. That's why you only give 1 shot once a month. You can also give 3 shots in 1 month and get something that lasts 3 months if you really want to do that. And they have approved the drug for that kind of treatment. But most people take it once a month. About half of patients patients who take this medication have 50% reduction of migraine, and that number right there is amazing regarding comparison with other older migraine preventive drugs, which are only about 30% reduction in headache. Then another 25% of patients have 75% reduction of migraine, and another 15 to 20% of patients with migraine will have 100% reduction of migraine, which is just amazing. When we first started using these drugs last year, I'd see patients have a very frequent migraine, give them the medicine, see them back in a month or so, and they wouldn't be having migraine at all, which is just incredible. I mean, they still have the gene for migraine, have the process, but the drug was giving them no headache at all. All right, what are the other drugs that we're comparing Ajovy with? Well, we're talking about Topamax, Depakote, or the beta blockers, or Amitriptyline. Topamax comes as a twice a day pill or once a day pill. It was originally first used for epilepsy and then for migraine. It has possible side effects of making you have difficulty with word finding or cognitive difficulties, so that in the lay consciousness it's called Dopamax. Makes you kind of dopey taking the medicine. Problem that's related to the amount of medicine you're taking, like 100 milligrams, if the doctor cuts the back to antibiotics, usually go away, but then the drug's not so effective for migraine prevention. It can also make you have tingling of your lips and fingers. It can make Coca-Cola taste flat. Valproic acid or Depakote was another drug that originally was used for treating epilepsy as a side effect for treating migraine. This is a drug that has side effects on babies in the mother's womb and shouldn't be given to anyone who's conceivably fertile or could get pregnant. Side effects of that are weight gain, constipation, tremor. Beta blocker drugs can have a tired syndrome and slow your heart rate down a little bit. And then Amitriptyline was a drug that first came out in '61 as a treatment for depression at a higher dose, like 100 to 125 milligrams, but it's used in migraine at 10 milligrams low dose. It helps people sleep, and of all the drugs that are listed for migraine prevention, Amitriptyline is one of the few drugs that will reduce headache a little bit and also help people sleep well. I've always asked patients when they start one of the new CGRP drugs to stay on their older preventive drugs just to see what happens. But many patients will want to stay on Amitriptyline even though they're on a drug like Ajovy, because they don't sleep without it. There's a special consideration for the drug for pregnancy or lactation where it's not indicated in that circumstance. So that's it. So this is my talk on is Ajovy useful for treating and preventing migraine? And I hope it helps all your migraine patients. God bless you. I'll see you again on another talk. Bye.